koutou, ko Annette Bolton toku ingoa. Kiti mahi aho kia ESR. So I'm Annette. I work for ESR based in Aotearoa, Christchurch. And before I start, I just want to emphasize something. This is not the Health National Adaptation Plan. This is the Health National Adaptation Plan version 0.1. It is really embryonic at the moment. And what I really want to talk about today is how we've gone through the process of developing what we've come up with at the moment, and also just give you some background about what Health National Adaptation Plans are all about. Am I doing something wrong here? Okay. I'm just going to skip this one because the next slide is actually probably more informative. So over the last day or so, yesterday, we've been talking a lot about climate change and health impacts, and I thought it would be quite useful to just talk about some of the exposure pathways related to climate change and health. So in this diagram, it looks a little bit complicated, but I will walk you through it. We have direct exposures. So they're things like wildfires, extreme weather events, flooding, etc. They're the sort of things that make the paper on the front news. And they're also, typically they can be quite catastrophic as well. And you've seen that happening quite a lot overseas. There's also more subtle indirect exposures. So they're things like changes in microbial contamination. Microbes are also climate sensitive, and some of those microbes are pathogenic to humans. We also have things like changes to pollen, because plants are also climate sensitive. And we've seen in other parts of the world that pollen exposure is increasing as well, which is causing quite a lot of problems, particularly in Europe and in North America. And things like that impacts on air quality, and also things like vector ecology, where you start to see conditions improving for certain types of vectors. And then we've got social and economic disruption, and they're things like changes in migration. They could be things like changes in food availability, and also access to healthcare. And they're all related, and they all impact on health. We also have these modifying conditions. So we've got changes to the environment. We know that it's going to get warmer, it's going to get wetter in some places, and it's going to get drier in some places. And all those things are going to change the environment that we live in the future. We also have social conditions, and they're often called upstream determinants of health. And they're things like changes to, socioeconomic conditions. And they can also impact on health via environmental conditions and health system conditions. So all of these things interact with each other, and they can modify health impacts. Now, this slide, I just want to explain what a Health National Adaptation Plan is. So according to the United Framework Convention on Climate Change, it's the formal health component of a national adaptation plan. They are designed to align with national adaptation plans, and a HNAP, or the equivalent of a HNAP, typically builds the resilience of the existing health system, so that it also sets strategic climate health adaptation goals within a period of time and with available resources. And that's a really important point. And they also have other names, so they can be called things like climate health action plans, human health and well-being action plans, but they're all pretty much mean the same thing. I just want to give you an example of how HNAPs are integrated into the national adaptation process. And this is just one example. It's from the World Health Organization, and it's a document called Building Climate Resilient Health Systems. So at the top, you've got your overall national adaptation process, which links into HNAP coordination. And underneath there, you've got all your different operational levels across the health system. And underneath the other overall NAP process, you also have on the right other climate sensitive sector adaptation plans, which are also coordinated between all those things. And we know that there are other adaptation plans that already exist in Aotearoa. So the Department of Conservation have one, and the Ministry for Primary Industries, I believe, also have one as well. I thought it might be quite useful to have a look at what adaptation plans look like overseas. So I randomly chose Australia since they're our neighbours. Their national adaptation plan is called the National Climate Resilience and Adaptation Strategy, and it looks at current adaptation and resilience initiatives across key sectors. So here's just an example of what some of those key sectors look like, and you'll notice there in the black, the first one is health and well-being, but there's also coasts and cities in built environment. There's quite a few of those. And something interesting that I found from reviewing the strategy was that the health impacts are described in the scientific research, which is publicly funded, and that's pretty much what's happening in Aotearoa at the moment. The scientific research is very ad hoc and it's not really coordinated very well at the moment. Australia have a national climate change adaptation research facility, and one of their goals is to maintain a network which focuses on vulnerable communities and human health and links researchers with decision makers. And I think that's an awesome idea and we should have one. But there's no national program that targets health effects of climate change, which I found very interesting. This particular strategy is being updated, so that might change, and that's why I put a note update there. And also the strategy, it looks at how to maintain health services, which is obviously really important, and addresses climate change risks and supports other sectors as well that can affect health. So things like agriculture, water resources, and infrastructure. So that's kind of a really useful way to think about how a HNAP might work. And this is at the national level. So at a more kind of regional level, a level that might better suit Aotearoa, there's also, oh, sorry, no, I need to talk about this. These are key interdependencies between those priority sectors. So each of these little round bubbles, these are all the different sectors. So you've got ecosystems and coasts. And this diagram I really like because it shows how correlated all of those areas are. And what's really interesting is if you look at the bottom, you've got health and well-being, and a lot of those sectors intersect with health and well-being, either directly or indirectly. And I think that's really important. What's missing in this diagram, it doesn't talk about anything about Indigenous peoples, but that's maybe just an Australian thing. Sorry. At a regional level, Queensland is a really good example of how it might work for Aotearoa. And I just pulled this from one of their documents. It's called Human Health and Wellbeing Climate Change Adaptation Plan. It was written in 2018. And this also has a lot of elements at the center. So you've got things like health promoting and emissions reducing policies, leadership and governance. All of these different components you see across all different HNAPs globally. So there's a lot of common themes that come out from HNAPs, and each country has a very unique version of that. And on the outside, you've got principles, they're core principles that run across those strategies. And that's also really common as well. I'll just let people take pictures in. Okay. So why is health adaptation important? It needs to be represented in the national adaptation process. It already is from the sounds of it. It also avoids other sectors inadvertently causing or contributing to adverse health impacts. So it's really important that that coordination is there so that we can make sure that decisions aren't being made that will adversely impact on human health and environmental health. It's the coordinated response, which also includes mitigation. I haven't mentioned that, but obviously that's there. It's at the front of all of these plans. Mitigation needs to happen first. Adaptation also happens at the same time, I guess. Hopefully, it would reduce demands on health services. It would minimize an increasing burden of disease, and those diseases would be climate-sensitive diseases, and build preparedness and resilience to the expected impacts of climate change, and save costs in the short and long term. That's what really will probably convince most decision makers. So the next slide, I'm going to talk about what we've done so far, the process that we've gone through. We started with a literature review back in 2018, just looking at what do those climate and health impacts look like. And around about the same time, you probably saw it, the Royal Society also produced a summary report on the health impacts. So it was really quite timely, and we worked together on that project. And then we did a report on the feasibility of HNAPs. So we looked at all the different HNAPs, or a selection of HNAPs across the OECD and also Pacific Island nations to see, is that something that was going to work for Aotearoa? Some key considerations that came from that review were how Māori can be active participants in climate and health adaptation planning and development, and how other sectors are coordinated and included in health adaptation planning and vice versa. We also held some central and local government workshops, and we interviewed some people as well to ask them what they knew about climate and health impacts and how coordination might work. And then there was a report on those stakeholder perspectives. And from that report, just a few actions here. Tiriti Waitangi led, that's quite clear. Support of equitable outcomes for wellbeing and population health, and enacting enabling policy, providing a clear role for the health sector and healthcare services to support climate change and adaptation planning and action. And so we got to this draft framework for the HNAP, and there's a little boat there to kind of represent the fact that at the moment it's kind of sitting in the harbour and it's not set out to sea yet. What needs to happen is there needs to be some collaboration, and that collaboration is starting internally within the Ministry of Health, and hopefully we'll go out wider. And did I introduce the ministry? I didn't, did I? Forgot. Okay, I'm sorry. The Ministry of Health team are right here. So could you just give a wave? And they've been involved in this process. And if I get any curly questions, I'm going to point to them. And the telescope is really to guide that boat into the right direction. We need to have this collaboration within the ministry and outside of the ministry so that we know that the boat is heading in the right direction. So we've come up with some draft goals and draft purposes, and draft is in capitals because we are not setting this in stone. We just wanted to have something on paper that we could start a corridor with. So the goal at the moment, as it stands, is that health and well-being in Aotearoa is resilient against the impacts of climate change. And the purpose, a bit longer, but basically it's by supporting communities to build resilience and adapt in ways that meet community aspirations, enacting enabling policy and supporting equitable health and well-being outcomes for Māori. This includes protecting the health and well-being of the environment so that Māori can exercise their right to kaitiakitanga and maintain the Māori and the health of the community. There's also some key principles. So processes and resources related to climate change adaptation support Māori tino rangatiratanga and mana moto haki, including the use of Indigenous knowledge, that we use the best available evidence and actions to make decisions, and we consider groups and communities, including Indigenous peoples, that are vulnerable or excluded. And I don't like using the word vulnerable, so I think there's probably a better word to describe that. It has negative connotations. Equity, communities should be involved in planning and implementation, as communities are the sites where multiple influences on well-being meet. That's where the bad stuff's going to happen, and that's where we need to think about how we're going to support communities. And engagement of appropriate stakeholders, iwi, and communities. So this is kind of like what we came up with in terms of what it might look like. These are draft elements. They're quite similar to what the World Health Organization recommend, but there's some slight differences. The main differences are the equity and Tiriti slice, and also the managing the determinants of health slice. And this is very likely to change when it goes out to discussion. There's an explanation of what these things mean. I'm not going to put the explanation of every 9 on there because you'll probably fall asleep, but this is just to give you a sense of what they look like and what they might mean. So for example, leadership and governance is about strategic planning and addressing the complex and long-term nature of climate risks. And then health and climate research, which is the one that I'm the most excited about. We need to start looking at the basic and applied research and how to develop that and coordinate that and hopefully resource that, because that's not really very easy at the moment. And one of the key considerations there is, how do we start using meteorological information and climate information to look at climate sensitive diseases. I think that's a really important thing to do. And also the equity and teacherity, that we start considering how does that work for Māori. There are some challenges. These are just a few examples of the 100 challenges that we came up with. No, not really. Resourcing, I've said that before. Resourcing is a challenge. Possibly the changes in the RMA might enable that to change. That's why there's a question mark there. It requires a top-down, bottom-up approach. We are relying on feedback from all levels of the health system, including everyone in this room. Surveillance, so there's some health impacts that we're not yet measuring, and we need to try and think about how are we going to evolve our surveillance systems so that we are doing that. And that includes combining weather and climate and health data. One of the other things that we found during our research was that when you have a Health National Adaptation Plan, quite often the implementation part isn't mentioned. And so I think that's really key. There's no point in having a plan and then not being able to implement it. And there's heaps of research gaps. So we need to start thinking about what those are and filling them. This is my last slide, and I just want to leave you with a thought, and it's a thought about co-benefits of health. And this was a conference that I attended online during lockdown. And it was a conference about healthy cities. And the speaker was there, and I thought he was really awesome. And he put this quote up, and I quickly screenshotted it before he switched to the next slide. And what he says is, resilience is a pathway to healthy cities. We must make health a driver of city transformation rather than a co-benefit. So I think that, we talk about co-health benefits almost like they're an afterthought. Why aren't we putting health and well-being and the environment at the center of all our decision making? So I'd like to leave you with that thought. Kia ora.